Hello and welcome to our webinar, Self-Care for Health Professionals. This is aimed at both student and clinician to better support themselves throughout their career. Firstly, I would like to start with an acknowledgement of country. We acknowledge the First Nation peoples of Australia, who are the traditional owners and custodians of the many lands on which you may be listening from today, and we pay respect to their elders past and present and those emerging future elders. We also acknowledge and pay our respects to our Australian First Nation colleagues and peers who may be listening to this. My name is Catherine Opcat, and I will be co-facilitating this webinar today. I'm a social worker who spent my career in the mental health and mainly with adolescents fields. I've been a supervisor to multiple students and currently work as a clinical educator with Three Rivers Department of Rural Health. I'll now hand over to my colleague to introduce herself.
Hi, my name's Julie Shivett. I'm a First Nations cadet with the Three Rivers. I've got a background in Aboriginal mental health and health, and I'm very happy to be here today to support you.
Thanks, Julie. So as I said, today is all about self-care and well-being. So we'll be discussing stress, how to recognize it and its impact, the ways to increase your knowledge on self-care, mindfulness and reflection, and how to identify self-care activities and strategies for maintaining those. We will conclude with a meditation to leave you hopefully feeling very relaxed and calm. Before we do start, if any of the content or discussion in this session raises any stress for you or is overwhelming, which it can be for some people, please be aware of the support services you can contact. We've listed some on the screen here, which you may or may not be familiar with. So we've got Beyond Blue, the Black Dog Institute, Are You OK?, Lifeline Australia, Men's Line Australia, Statewide Mental Health Line, and your employee assistance program can also be a great resource for you if you have one at work.
So what is stress? Stress is subjective. It's not measurable with tests. Only the person experiencing it can determine whether it's present and how severe it actually is. Stress is a normal human reaction. In fact, the human body is designed to experience stress and react to it by producing physical and mental responses. We experience stress when there is an imbalance between the demands on being made on us and our resources to cope with those demands. No one is immune to stress, and it is normal to be stressed sometimes. Some stress can be beneficial as it creates alertness, energy and motivation, but long-term, unmanaged stress can cause physical symptoms, emotional symptoms and unhealthy behaviours, and this can lead to burnout. Recognising stress. Psychological feelings of agitation, anxiety, tearfulness, feeling blue, down, moodiness, lack of motivation, irritability and indecision. Physical signs can include exhaustion and fatigue, digestion problems, headaches, loss or increase of appetite and muscular pain, poor sleeping. And behaviour, fidgeting and pacing, increased drug and alcohol use, and withdrawal from social activities or aggression. So how do we feel when we are stressed? We can become less rational. I can't cope with this. I don't have enough time for this. This is too much. We can become more reactive and things can seem more urgent. We can become more irritable and difficult to deal with and work with. We can be less flexible in our thinking, less open to other people's ideas and suggestions. We can experience reduced concentration and loss of focus. We may want to have our needs met immediately.
I think just going back a slide, Julie, I think you had some good notes there.
Yeah.
Yeah. Do you want to read those out as well?
Yeah. So in 2014, research shared by the Beyond Blue suggested that health professionals are at greater risk of experiencing anxiety, depression, and suicide. Risk factors in the workplace include heavy workloads, long working hour, shift work, bullying, harassment, occupational violence, and balancing work and home demands. It is acknowledged that regional healthcare professionals may be exposed to unique stresses compared to the metropolitan counterparts, such as excessive travel, more limited healthcare and practice resources, greater sole responsibility of complex health issues, and difficulty accessing leave.
I think all of that would sound pretty familiar to most health professionals, that whether you've been in for a couple of years or decades now, and especially in the recent years, these things have, I guess, become even more of a rising issue. So reflecting on that and all those points Julie just gave, we're going to allow a couple of minutes here for you to reflect on the questions we've put on the screen. So have a think about your time as a clinician, or if you're a student, have a think about if you've had any time on placement or observing other clinicians and what stresses impacted you. Then more broadly, how does being a rural clinician impact on work and stress? So we will give you a couple of minutes before we'll continue. So just have a think of these things and see what you might come up with. I hope that was enough time for you guys to have a think about that. I mean, just reflecting on it myself, something that generally comes up for me is just the stress of the wait times and, you know, trying to balance an effective, I guess, service delivery whilst also seeing as many people as you can. And knowing that there's such a long wait list there can be a really big stressor. So I think keeping that in mind, self-care was always a really big priority for me. So hopefully as we move through whatever you've had a chance to reflect on here, we can work on in when you learn about more about self-care. Julie.
So looking at the causes of workplace stress, there's lots. Work politics, lack of recognition, bullying and harassment, long hours, workload and control over your workload, feeling unsafe at work, lack of support and isolation, unfairness, and lack of job security. Warning signs of burnout. What's the difference between stress and burnout? Many of the signs of burnout may appear very similar to signs of stress. However, the difference is that the people who are experiencing burnout are struggling to practice and manage everyday life at home and work, and they can become inoperative in their work altogether. Stress is more likely to present as symptoms you may see in someone experiencing anxiety, whereas people experiencing burnout are more likely to present with depressive symptoms.
And as it says there as well, you know, burnout isn't just a response to working long hours. It's those feelings of exhaustion, cynicism, and a reduced sense of accomplishment after suffering just long-term job stress. And researchers estimate it could affect anywhere between 8% of workers to 60% in some industries, which is quite significant, don't you think, Julie?
Quite a lot.
Yeah.
And these are very common issues with health clinicians, and it's something to really make sure that we're aware of in our day-to-day practice.
Yeah, that's so true. I think keeping it, just as you said, day to day on your mind as much as you can.
Yeah. And this is our toast analogy. So it's looking at how burnt out we are, and it gives you a really good visual of that. So how toast are you? You can give yourself a score out of 1 to 9, and where you are at the moment. And it's something really, to reflect back on quite regularly.
Yeah. Just keep that in mind, what your score might be as we move through the next couple of slides. Yeah. Okay. So having had a quick thought about how toasted you are, we'll move into our strategies for self-care now. So we've just gone over what is stress, what is burnout and the difference, and how toasted you are. One of my favorite quotes regarding self-care is that self-care is giving the world the best of you instead of what's left of you. And that's by Katie Reed. I have this pinned above my desk as a reminder each day to put myself first as much as I can. I know that doesn't always work out, but it's a present reminder there that the importance of self-care can't be underestimated. So when looking at stress management, we need to have a focus on self-care. A balanced lifestyle and coping strategies can help manage stress, and issues that cause stress cannot always be avoided or resolved, but sometimes changing your expectations of a problem may help. Considering these two analogies on self-care that show us how important it is. The oxygen mask analogy, which I think a lot of people might have heard of. So on airplanes, you're always told to put on your own oxygen masks on in an emergency before others, even before your children or any elderly relatives. So this is because if you don't look after yourself first, you might run out of oxygen and not be able to help those important to you. Self-care is the same. If you don't look after yourself, you won't be able to look after others, not effectively anyway. The phone charging analogy is a new one I've heard of. So every night we put our phones on charge so that it can work the next day, work efficiently, work for a long period of time. If you don't plug it in, it'll either not function properly in low battery mode, or it'll run out of energy just completely and just go dead on you. Just like you plug in your phone, you need to carry out self-care every day to energize yourself and make sure you're able to perform the way you want to the next day and the way you need to. Now, putting those analogies into your mind, let's put all this into practice. So at its core, self-care is about regular activities that help you recharge, like the phone, and make you feel good. Therefore, you need to be thinking of daily activities that you can easily implement into your routine. For this to be successful and be able to maintain the routine, which I know a lot of us struggle with maintaining a routine and a new habit, you need to consider behavior change strategies. So similar to those we may discuss or implement with our clients. So we've got 3 here: habit stacking, setting a timer, and one goal at a time. Habit stacking, obviously, as it sounds, involves stacking a new behavior on top of an existing one. This pairing approach works due to something known as synaptic pruning. The idea behind synaptic pruning is that the brain prunes away connections or synapses between neurons that aren't used very often. It also builds up the connections that get used most often. Creating and strengthening specific connections between behaviors can help you make lasting habit changes in your daily life. An example of this, or habit stacking, might look like you're doing 5 push-ups every time you pour yourself a cup of coffee in the morning. You already have the habit of pouring coffee or having a tea, and now you're creating a new habit on top of that by stacking push-ups with it. I personally would not choose push-ups, maybe a squat. Push-ups is a bit much for me, but that's the general idea that you've already got one habit that you're used to, stack another on top of it, and it helps you connect that and keep that daily. Another is setting a timer. So when establishing new and healthy behaviors, sometimes the simplest approaches are the ones that are most effective. For example, setting a timer on your watch or phone to go off at regular intervals can be very powerful. If you need to be drinking more water, consider setting an alarm that goes off once every couple of hours and reminds you to drink a glass or 2 of water. That way you won't have to worry about creating a space in your brain to remember to drink. Your phone or watch will do it for you. And I mean, I say watch in the fact that, you know, these new Apple Watches and all these things, they do automatically have reminders to get you to stand up and things. But if you don't have that, it's just as easy to pop it onto your phone. And then lastly, focusing on one goal at a time. You may be thinking now of several activities you would like to do to improve your self-care. But when we have too many goals that we're trying to achieve at once, it can be easy to become overwhelmed and end up not accomplishing any of them. So to increase your chances of success, focus on just one goal at a time. This can allow you to dedicate more time and energy to accomplish it and increase the likelihood of establishing a healthy, sustainable habit. And then from there, if you want to, then you can add in another one once you feel like that first goal, you know, has been stacked with another habit and it's just become ingrained. One quick little tidbit here is to smile. When you smile, your brain releases tiny molecules called neuropeptides to help fight off stress. And then other neurotransmitters like dopamine, serotonin, and endorphins come into play too. The endorphins act as a mild pain reliever, whereas the serotonin is an antidepressant. Frowning actually releases the feel-bad hormones such as cortisol, the stress hormone. And cortisol is actually more difficult to reverse than, you know, if you starting off your day with a smile, I guess. Some other examples that we can give you for little activities of self-care might be running your hands under warm water for 30, 60 seconds mindfully whenever you go to the toilet during the day. That is another example of habit stacking there. I mean, hopefully you're already doing the washing your hands bit, but doing it mindfully for an extended period of time. Going for a walk outside during your breaks, eating healthy snacks and meals and drinking enough water, taking time to clear your desk at the end of each day, making your workspace inviting. This is one that I make sure to do every single day, and now it's a habit, because coming in the next morning to a desk that is clean and clear just makes a world of difference to how I feel first thing in the morning at work. If I was to come in and see just papers everywhere, it'd just be like, oh my gosh, there's so much to do. Where do I start? At the end of the day, I spend 5 or so minutes just clearing it up, cleaning it out. It feels so much better. Some other ones. Yeah.
I've got one that
Yeah,
I
go
used
for
to do. Yeah, as a mental health clinician, as soon as I finished work, I would go home and take my uniform off straight away, and then that would sort of put me in home mode, so I'm not thinking about work anymore. Like,
yeah,
that was a big one for me, to just switch off.
Yeah, that's such a good one too. And even if you don't have a uniform, I guess you've still got kind of work clothes you can change out of.
Yeah, or your uniform or whatever you happen to
Yeah.
wear. Yep. Or take your badge off, or yeah.
Yeah, some sign that like work day is done, I'm at home.
Yeah.
That's such a good one. That's really good. I like that. And then yeah, the other ones we've got there about writing 3 things you're grateful for each day or telling someone. At the end of the day, just take a moment to think about what you've accomplished and not what you didn't get done as well. I know we can often get caught up in, oh, I've still got to do this, 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 and this, and I didn't get this done today, which I wanted to, but what did you get done today? And remind yourself of that first and foremost. They're just some small acts of self-care you can use if you need.
So our another reflection activity. What is one self-care activity you can commit to putting into daily practice in your work life as of tomorrow? So we've got some ideas there up there for you, listing your supportive people to talk to, what your healthy habits are, or you would like to start. Some daily positive affirmations, being grateful for what you did get achieved. It's been a beautiful day. New or past activities to give a try. Your favourite helpful coping skills. Thoughts I can say to myself instead.
Okay, hopefully that's been a bit of time for you guys to reflect on, just one activity you can commit to putting in tomorrow. And there are a lot of these templates available online, heaps of different sites. Just have a Google and you can find some. Just continuing now into mindfulness. So a popular self-care strategy is practicing mindfulness. It's an awareness that arises through paying attention on purpose in the present moment, non-judgmentally. 2 metaphors that are used to explain the practice of mindfulness are to picture your thoughts like clouds in the sky, just floating past or above you. Notice these thoughts, but don't judge them. Another metaphor is that mindfulness is like the difference between driving a manual car and an automatic car. Then we've got 2 forms of mindfulness. So formal mindfulness is a mindfulness meditation where you sit usually with your eyes closed and focus attention on one thing. Example, your breath or the sensations you're feeling in different parts of your body. It's the most common form of mindfulness I think people think of when this is mentioned. But there's also informal mindfulness, and that's when you bring the same kind of improved attention that you might get from formal practice to everyday situations, and it involves directing your full and non-judgmental attention to the activity you're undertaking at a particular moment. It might be washing the dishes, brushing your teeth, chatting with a friend, or studying. And yeah, it's just learning to stay in that present moment, because it's overwhelming and exhausting to get caught up in the past or ruminate, which is just overthink about the future, and it hasn't even happened yet. So using mindfulness can bring you back to the present and where you are. How is it helpful? Like I just said, it can reduce worry, anxiety, and distress. It creates a sense of calm, teaches you to relax and regulate emotions, improves concentration and increases productivity, helps develop a sense of empathy and connectedness, and does prove to have better quality of health and sleep when you consistently use this practice. So I've got these 2 images here just to give an example of what our mind can look like at any time. So think about your mind being like one of these 2 rooms, and I know mine is sort of generally in the middle. And neither of these are actually representations of my house. I wish the clean one was, but it is not, unfortunately. When we're not practicing mindfulness, we can feel overwhelmed, stressed, and our minds can seem really cluttered, like in that room on the left. Because our minds are busy and we're not paying attention, unhelpful thinking and negative thoughts can creep in, they can stack up, they clutter around the place, and it's just disheveled and a mess. When you have negative thoughts, you just notice that you're having them. Let them come and then disappear again, and try to redirect your thinking to the here and now. Like we were talking about with those clouds, just knowing they're there, floating by, not giving them your full attention, just acknowledging their presence. Saying that mindfulness is a skill, and like any skill, you need to practice it to get better at it and for it to become a habit and just ingrained in your unconscious behaviors. So with that in mind, I thought we might do a little mindfulness exercise. It'll just be a couple of minutes. In that time, we might turn our videos off and see what comes up. Sorry, not see what comes up, just hopefully see how you go with this and go from there. So this exercise is about stepping out of autopilot to bring awareness to what you're doing, thinking, and sensing at this moment. Please get comfortable in your seat, and if you prefer, feel free to close your eyes. Try to pause and take a relaxed but dignified posture. Notice the thoughts that come into your mind and acknowledge these thoughts, but let them pass. If these thoughts return, just notice them and redirect your thinking to the present moment. Attune yourself to who you are in your current state. Now, bring your awareness to your breathing for 6 breaths or about a minute. Breathing in, breathing out. The goal is to focus attention on just one thing, your breath. Be aware of the movement of your body with each breath, of how your chest rises and falls, how your belly pushes in and out, and how your lungs expand and contract with each breath. Find the pattern of your breath and anchor yourself to the present with this awareness. Now, slowly allow yourself to notice any thoughts that come into your head as you become aware of your breathing. Take notice, pay attention, and accept these thoughts without making a judgment on them. In this exercise, thoughts are not good or bad, positive or negative. They just are what they are, the thought that you happen to be having at this particular moment. In this space, you are the observer of your thoughts. You're watching them as they float by. Consider that metaphor of allowing your thoughts to just float by like clouds in the sky, noticing each passing thought, and then the one that comes after that, and then the one that comes after that. You may notice that just at that moment, you become aware of a thought. It passes and is replaced by another thought. That's what happens. Thoughts come and they go. If you notice yourself engaging with thoughts, just bring yourself back to being the observer. Engaging with your thoughts is what we normally or often practice, so don't worry if this happens. Just try and bring your attention back to being an observer of your thoughts rather than an examiner. After a few minutes, bring yourself back to awareness of the breath. Now, expand your awareness outward, first to the body, then to the environment. Notice the sensations you're experiencing in your body, like tightness, aches, or perhaps a tension in your face and shoulders. You can even try tensing up any of those muscles and releasing them, and see how that feels. If your shoulders start to drop as you relax, your feet planted more firmly in the ground, and thinking and focusing back on that breath, going in and out, in and out. When you're ready to finish the exercise, if you haven't already, please open your eyes slowly, return to the session, and it can be good to try and carry that mindfulness with you as you go about your day. Hopefully that's helped you feel a little bit more calm and relaxed. I know for me, for one, my shoulders are already a little bit more relaxed. They were more tense than I thought they were. We'll come back. Okay. There are a lot of those kind of mindfulness activities or progressive muscle relaxation scripts you can find online, or even quite a few apps you can download on your phone. So there's Smiling Mind or Headspace, a lot of those. A lot can be free, some are free to a certain point, but yeah, trying some of those and keeping them on your phone can be really great. We've just got our resources here and the references we used. And then, yeah, I'll hand over to Julie.
So here's our online modules and future PD events. If you'd like to have a look at some of our other webinars and live webinars as well, you can have a look on the Three Rivers website. They're all free online learning modules for clinicians and students, and it's really great to check those out.
Yeah, and those online learning modules are also available just year-long, and so are the webinars.
Thank you for your participation today. Please complete the evaluation to receive your attendance certificate, and the link to this is available on the Three Rivers webinar homepage. And thank you again for attending our session today.
Yeah, thank you so much for joining us and listening in to us. Good luck with all of the new self-care activities, and we hope you've learned a lot and are able to implement one or two of them in your day-to-day now. Thank you.
Thank you.